Today we'll be learning about reconstitution. Reconstitution is when you're taking a powdered medication and turning it into a liquid form to administer it to a patient. What we'll be using today is a medication. This is a demo dose, so it's not a real medication. It's 200 milligrams per milliliter, and we're going to administer 10 milliliters of liquid into it to reconstitute. We'll be using a 10 milliliter flush and a filter needle to accomplish this today. So first you're going to open your flush and apply your filter needle. Before you apply the liquid into the powder, you're going to want to push out the little air that's at the top of the flush, just like that. In order to take the top off without using an alcohol swab, you just pop it off without touching it. Take your cap off of your 10 milliliter flush, put into the rubber stopper, and push down to administer the fluid into the powder. As you do this, the powder and the fluid will begin to mix, and you might feel a little bit of pressure. That's normal. You want to agitate it just a bit to be able to mix all of it. And when you feel as though all of it is mixed, you can begin to pull back on the medication. Because of the pressure, it should fill automatically. At one point, you might be able to have to pull back on the medication to fill the remainder of the syringe. And once you have filled the remainder of the syringe, it depends on what the dose is, but normally it will fill the entire syringe. You can flip it back over, pull it off. At this point, you want to discard the filter needle and put on a red cap and label before administering it to the patient.